front of exam. So now I will share all my presentations and all the pictures I need it. Okay. What I will do without specific presentation, only in case you to get information where you can find easy parts and pictures. Sometimes I have no idea and think that I gave something very special only from medical books. No, my dear. Information is everywhere and you can take it from the sites as well. But the only idea is that medical student, a student who is close to the medicine, have to be so smart to differentiate portion we need from some joking or some, I don't know, false sites and so on. So let's begin from the skin. You remember we spoke about the skin colors. Skin colors is mainly 4 or 5 colors, which we discussed on the previous our meetings. Yeah, remember. So the first is a reddish color of skin. Can be from the sun tanning or sun burning, excuse me, from sun burning, yeah? So it can be, but as well, it can give you information about the dilatation of the arteries. Remember? My dear, I cannot read what you write to me. For sure, it's some
All good,
additional.
Professor. I just asked him about, like, we were discussing what is exactly the material for the first midterm because we're a bit confused.
Oh, my dear, it's better to check up with Salomechi Burdanidze, but I am sure all the weeks in front of your midterm, but not the last lecture in front of your midterm. I never gave you the last lecture because you need to check, to read, to study it, yes, and it's very close to the exam. So last week I never gave, but other weeks, for sure, 100% will be in the midterm. So when you have midterm?
We have it on this Monday.
On this Monday. So, okay, from cardiovascular, I think I do not give you any kind of question, but about the skin and changing and correlating the skin color with the cardiovascular system will be because it depends on the skin portion as well. Understand?
Okay, thank you.
Okay, I have no ideas which part Madonna will give you. I think everything that she discussed with you on the lectures will be in her exam questions. Okay? Okay, it's simple. So, let's go. You remember the reddish, it's dilated of the arteries, perfectly why arteries, because here, as I say, close to the skin, and you remember we had this picture of the skin where perfectly these arteries and veins are. In arteries we have blood full of iron, and iron is connected with the oxygen, and this chemical connection give to blood more red color. So dilating of the arteries give skin coloring in red. That's why. So when it's dilated, we have to speak about the abnormalities in the arteries, abnormalities in full body, or some high pressure of the bloodstream, which makes these arteries dilated. When it can be high pressure, the word can give you information. So high blood pressure. When it is, when we have heart problem, heart pumping more blood with high pressure, and it cannot go through the narrow artery somewhere, so pressure increased. So when you have high pressure, someone says that, oh, he's hypertonic, his pressure is high, it's 160 on 100 or something. You can imagine that color of his body sometimes change to the reddish, where the arteries is most close to the skin. Where it is, the first, you have to think about the face. So face, in the face we have a lot of arteries which perfectly are communicated with the inner part of the head. So dilatation of it will give you reddish color on the face. So when you see the person became red and cannot breathe normally and has some maybe dizziness or some other kind of, you have to think about the high pressure and check it in the first at first. So the second one, and I will find if I have this in the previous videos, my dear. Okay, here. And the second one, yeah, sure. That's what I want to show you. It's a cyanosis. Remember the cyanosis? So bluish color, yeah? Bluish color can be peripheral and central. I will switch on my old lecture for this point. Maybe some interesting was here.
Okay, my dear.
I see.
Today we will speak through and get some information from here. How to change it on slideshow, I have no
You can
idea.
find this lecture as well on the site.
Something like this. Okay, doesn't matter. So, first of all, how we begin our examination is
Professor,
changing.
you're lagging so much. It's so hard for us to hear you.
Once again.
You are lagging so much. It's hard for us to hear you. Your internet is not good.
Okay, my dear. So here is picture, okay, only, and I will speak it by myself. So see the fingers ending are bluish. Do you remember what it means bluish? Bluish, it's the nose, perfect dilatation. So why the nose vessels dilated gave you bluish, not reddish color? Because here is not a connection between the ferrum and oxygen, and this is connection with CO2. CO2 with by chemical organization is more blue than red colors. That's why dilated and expressing this color on the skin will give you bluish. And it's named cyan, as I say, it's Latin word which translated like blue. Cyankobalamin and other kind of colors exist perfectly. It's peripheral when it's far from the center of the body, or central as on the picture here with the face. I say that mainly the children has it in the triangle between the upper limb and nose. Yes, this part will give you information about the, if it is peripheral, perfectly, it's about the stretching or dilatation of vein, so not heart disease, only pressure of the blood stream and problem with the blood stream in the veins. It means that vein vessels has its own problem, can exist. What about the central? It's mainly give you information about the heart, what happens, and when we go and we will do excursus the anatomy perfectly, you will understand that when the circulation between the lungs and heart is not right, we will have this kind of problem. So it means that blood is not normally going to the lungs. It's not changed with in the lung oxygen to the CO2 or CO2 to the oxygen in the inspiration and expiration. So that's why these colors on the lips are more bluish. When it happens when we have problem inside the heart. So it's a problem with the circulation between the big and small circle of the. You remember the circles? I think no, but we will go through it once again. So so the first examination of the heart, cardiovascular system. So cardia cannot be except the vascular. So it's together heart with its vessels. That's why we speak about the peripheral cyanosis as well. The first examination always begins with observation. Observation means that with your eyes, you, from the first view on your patient, note and sign some information about it. So first, color of skin is normal, not reddish, not bluish, not pale. What is pale? When we have not amount of the red cells, red cells amount in the blood vessels. That's why it became not blue, not red, but white coloring. So see on your patient. If no changing in the colors exist, calm down and go to another step of the examination. Now we have to find perfectly where heart is and how it works. So where the heart is in our body, who knows? Is it on the left or on the right? Guys?
It's a bit on the left side.
Mainly on the left, but to be sure it's not perfectly on the left or perfectly on the right. I will give you some situation which happened with me, and that why I will give it to you to avoid any problem. Happens sometimes that a person has abnormality. It can be congenital from the birth period or after the accident. So I have my neighbor, and when I was, it's 30 years ago, can you imagine, student, and started a heart examination, I try to do it on everyone who is near me. On my father, on my mother, sister, brother, everyone is my patient that period. So neighbor came to us and asked to examine his heart. So when I auscultate his heart, I can find nothing. Why? Because he was joking with me. He has abnormality. He has heart on the right side. Can you imagine? After a car accident in the young childhood, every his organ turns. So heart was on the right, and I do mistakes, scared, and do some big mistake in examination. So carefully ask your patient about the past history. Was any accident, surgery is done? Because if we have maybe lung cancer as well, and one lung will be taken out, so heart position in the thoracic portion will be changed from normal to abnormal side. Okay, that's why. As well on the X-ray examination, and it will be sometimes given to you like only note that heart of your patient is a vertical or horizontal line. Yes, it's a very informative to us, but for sure we must be so smart not to take only information, but getting more information. Why it happened? Is it pathological? So happens something that heart change position, or it's a logical understanding that some surgery done. So maybe he has only one lung. That's why heart became vertical, not lying oblique. But to understand what is normal and what is abnormal, we have to know slightly anatomic of the heart. So I will take some pictures. So some of them you know, some will be new. So as you say, it's not perfectly on the right or left or middle side, it's from middle to the left. I agree with you. So we have sternum, or thoracic bone is named in the non-medical students, so in the middle. Yeah. So behind it is main mass of the heart, and slightly on 5 centimeter, maximum 6, on this point you can see, it goes out to the left side from the midline sternum position. So where it is, middle to the left. Now, I think everyone remembers this kind of picture of the heart. And cannot recognize here all the portion, and I will give you explanation why. When we describe heart, we know that heart has 2 atriums, 2 ventricles. Yeah, sure. Right atrium, right ventricle. Left atrium, left ventricle. Sure, but on this picture you cannot recognize it. Why? Heart is not, how to say, very horizontal. Yes, or see, this is right side going to the more frontal side. So turn heart, not only oblique as it said. Okay, okay, let's begin from this part. Okay, heart is not vertical. So apex of the heart is looking on the left side. This is the first what you have to remember. If it will be vertical, so this apex will be on the very low position. Yes, base of triangle will be on the upper side, but no, it is oblique. See, base is looking to the right side, oblique, and apex goes from the midline to the left side. So it is big lined in our body, but it's not all. It's as well torn. So right side turn to the frontal side. So left side looks to the back. Understand? Right side looks to the frontal side, left side to the back. That's why when you will auscultate or check patient from the frontal side, main part you will check right side of the heart. Understand? And to find the left side, you have to do it from the lateral side or from the back side. Once again, heart is not vertical, it's oblique and turned more right, more. It's not said that perfectly only right ventricle. This part is ventricle, and behind this auriculus is the atrium. So it's not only right side. From this yellow sees, it's yellow fatty structure here, but perfectly we have arteries here. This part, this border of left is part of the left ventricle as well. So mainly right ventricle is on the frontal side, but as well we have part of the left ventricle. So now if left ventricle is dilated, it means became bigger. So from the frontal side, you can find problem in the left ventricle. Yeah. If right side will be dilated, it will cover the left side. So left side will be seen only from the lateral side or from the back of the thorax. So I will check if some better picture exists. Okay,
Teacher,
let's see.
we
Yes.
can't hear you very well. We can't hear you very well. You are lagging.
Oh my God, what to do? It's technical problem for unfortunately.
I don't know if it's from your mic that's not close to you or from the internet, but we can't hear you.
How and now is it
Yeah,
better?
right now, perfect. Yeah, yeah.
It's much
Okay,
better now.
thank you. I
Yeah.
switched some button. I do not know what it is. So if my voice disappeared, write me please. Okay,
Okay.
I am not so good in the technique as you are right now because I'm old formation, unfortunately. So once again, heart is not vertical. If it would be vertical, both atriums will be on the base and apex. This is apex, the narrow part of the heart of this triangle. Heart is triangle kind of will be in the low. But no, it is oblique as you say. But another is that heart is turned, so right side is more on the front side than the left side. Left is narrow, right is bigger part of the frontal side. So What else we have to know? That we have 2 atriums, 2 ventricles. You remember. What is atrium? What is ventricle? From vein, blood is going to the atrium in the right part, collected here, then this door named valve opened and gave permission to go this blood to the right ventricle. Understand? So which blood will come here? If it comes by the vein, it must be
Right.
yes, but what kind of blood will be inside? Full of deoxygenated blood with CO2, yeah? So it comes to the right, collected in the right ventricle. So these doors between the atrium and ventricle closed, or it will be regurgitation from the ventricle. It will go back when the heart will contract it. It is the biggest problem, yeah? So door or valve closed, and by the contraction of the heart, all this blood will go to the new passage, the pulmonary, which one? Arteries. Here is blue colored because only one artery in our body, named artery, but has deoxygenated blood. Why it's happened? Because we name the vessels by their position and bloodstream. Blood coming from the organ to the heart, towards the heart, named vein. From heart towards the organ, that's what happened. Then in these pulmonary arteries, we have venous blood. It takes blood from heart to organ, that's why we name it artery, but inside we have deoxygenated blood. Understand, yeah? So, in the lungs, it divided on the small arterioles, capillaries, change oxygen and CO2, then collected once again in the capillaries of venous, and comes back to the left side. So once again, arteries, vessels which come from the organ towards the heart are named veins. Which kind of blood must be deoxygenated made, but only in heart we have with vice versa. Coming from the lungs, blood is full of the oxygen, but the vessels where they are can be named veins. Understand? So it comes collected from the lungs, come to the left atrium, then open the door between the left atrium and ventricles. This blood is collected in the left ventricle. Close the door between the atrium and ventricle. Contract the heart muscle and press it to the main artery of our body named aorta. And then it will go to all our body. Now look on this picture once again. You can imagine that the muscle on the left, and this structure is muscles of course, is wider than on the right. Why? Who can explain me?
Because it's more pressure, so
Of course, must be, because if from the right side, by contraction, we press it to the lung only, and the lung is so near the heart, you remember? You do not need big pressure here, yeah? So from the left one, you have to make blood stream, which will reach all the parts, like fingers of your legs as well, yeah? So you need high pressure in the left ventricle, and it can be only by the high contraction strength of the muscle. Am I right? I think yes.
That's
yes,
right.
Professor.
Okay, so which kind of problem can exist here, and how we can examine? Because we cannot open thoracic part, we cannot look inside, and we only observe. So first of all, we will observe our patient. I will take some patient somewhere will be. Okay, I think this one will be better. So underneath the skin we cannot see the heart. Heart beating sometimes can be seen if person is very thin, yeah, so all his ribs and portion between the ribs is so thin by the skin and muscles that we can see heart beating. This is the first. And second, if person is normal but heart beating is seen perfectly here, look, and I will show you where perfectly this point is. It means that heart beating is so stressful that shake all the tissues, and you can see outside. Yeah. So in a normal person, perfectly you can see nothing mainly. So this palpitation and the heart beating mainly are seen when the heart is working over hard or person is very thin. How to name the person who is very thin? Dystrophic. So dystrophia is kind of the disease when sometimes it's alimentary. It means that no food exists, and we have a lot of places where the person are so thin, or after a lot of diseases he became, yes, this dystrophy kind of. So
What do you mean? What do you mean this person is very thin? I don't
I
understand.
will show you, my dear. One moment, please. It's only the portion, so I will write another word which perfectly is the end of dystrophia. Anorexia. Can you see this guy? Or this one? Can you see?
Yeah, thin.
So
Yeah.
this is dystrophia of the tissues. Why it happens? This alimentary one is when person avoid eating or nutrition. It's anorexia, which is one of the diseases, which is psychological as well, which gave you this kind of dystrophia. Sometimes girls want to be beautiful but cannot stop diet and became this kind of, it's anorexia. It's not beautiful, sure, my dear. So they became like this one, yeah. So it's men, but for sure it's not normal. But this kind of changing in the tissue, dystrophy, or this means lack of trophia. It's nutrition, lack of nutrition of the tissues. It can be, as I say, psychological when it's anorexia, or it can be after a lot of viral infection or bacterial infection as well.
There's also, I think, bulimia nervosa. I think that's what it called.
Yes, bulimia nervosa as well can give you this kind of, perfectly in the bulimia nervosa body weight is normal, but can be as well because they took out or vomiting all the food they take in. Yeah, sure. It
Yeah,
can
and
be as
it can change the tissue because it's so acidic coming out of the stomach.
well. Okay, and look here, perfectly behind we have heart, and heart beating can be seen or between the ribs, because it's so thin now, this tissue, that follows the heart beating. Understand what I say? So, and where perfectly you can see it. where is the point? Behind the sternum, behind the hard bone, or how it's named on the thoracic side. Some in non-medical person, I have no idea, but perfectly in the middle of thoracic, we have some flat bone behind which the main part of the heart is hiding, so you cannot see anything. So only on the left side, on the low position, and this is fifth intercostal. Yeah, fifth intercostal. Intercostal means between the ribs. After the fifth, between the fifth and sixth rib, the soft tissue is intercostal space. From the sternum, from the midline of the sternum, it's about 6 centimeter. You will find this place by your fingers. How to calculate, my dear intercostals? Find if, okay, this is a point. See, my dear, if you will find clavicle, and I think clavicle by palpation of your finger you will find, at the sternum, first depression between it is first intercostal. Let's calculate 1, then follow the sternum and you find some eminential leg bones and depressions. Second, eminential depressions. Third, eminential depression. Fourth, and so on. Yeah. So fifth and sixth. So fifth, sixth intercostal. After the fifth rib, between the fifth and sixth rib, on the left side, 6 centimeter from the midline, it's the apex of the heart. Why we have to know? It's the most close to the skin part of the heart. I say that heart is oblique, that is turned right side up, but I forget to say that base of the heart is more deep than the apex of the heart. Apex of the heart is so close to skin that you need only 1 centimeter to reach the apex in this point. Understand why it is important? So injuries which happens in this part, in accident or in the fighting and so on, it can damage heart very easily. Knife injury or in a car accident, it's some heart portions that can cut this. So you have to think about the heart very dramatically because it's only 1 centimeter to reach the apex. It's about the accident as well. You have to think about this place when you do adrenaline injection. Sometimes person who is unconscious or fell unconscious, yes, or heart beating stopped, need a specific injection of adrenaline. So where you have to do it? Perfectly in the heart. How to do it? You will find this place the closest to the skin and do injection. So your needle, which is 4 or 5 centimeter long, perfectly will go inside. Understand the heart, and it will be done right.
Where exactly should we inject it?
So once again, calculate pressure is the sixth pressure by the places between the fifth and sixth intercostal place. From a mid place, from the midline on the thoracic one, perfectly it's for your fingers. So take your 4 fingers and where your fourth finger ended on this intercostal. It's enough place, and you will perfectly find your apex of the heart. And this is maximum impulse as well. Point of maximum impulse. Name this part by, because you can by finger find the heart beating as well. It's the most close place which you can examine by the finger and by other points. Let's see if no, the best is here. So what you have to do, you have to take your hand on all these areas, portion by portion, because if by your eyes you can find no beating, you have to check it by your finger as well. So why? Because sometimes it's very informative how stressful is beating, where perfectly you can feel. If you feel more on the upper side than in the low side, so it means that ventricles produce it less than in the atrium, yes, or in the main arteries like aorta, which gave you this shaking, or the main veins, which comes to the right side of the heart. I will show all these pictures how to check it. So he is looking for apex, you see. So another how it's described in your books. Apex of the heart is below your nipple is named. This is round points on the thorax. Below it on the 1 centimeter and 1 centimeter toward the thoracic side. But I cannot follow these rules because at first not every person has the same symmetrical part of the thoracic side and of his breast as well. And if we will check the women, some women has big ones, someone small breast. So how can I follow this? Yeah, sure, it's normal. So once again, what we are doing at first, we are looking on our patient, find out all the skin changing. Okay, if skin color is not changed, then we will ask our patient to take off the coat or something that he has, t-shirt or something, and review the part of the thoracic. Why we have to know it? Because if person is seen or has some heart disease in the apex mainly, but in the other parts as well must be checked. Pulsation and heart beating can be seen. Why I say about the other parts? Because heart may be normal, but maybe we have stenosis of pulmonic area, arteries or aorta. So stress of the contraction can be seen on the upper side, somewhere at the clavicle part, or in the notch where the sternum bone is goes to the neck part. So in the soft part, it's named notch. So you can see heart beating by your eyes. When it happens, when we have some problem with the pulmonic or aortic portion. So let's go further, my dear examination. When you do observation, you do then palpitation. By your eyes you find nothing. Now you will palpate your patient, take your hand on, find if some emanation happens, if some beating can be felt by the heart. Why about the emanation? Because through the life period, if heart disease exists, heart beating change the thoracic part here. And if we have some, in some disease, not always, the cost on the left side is not the same as on the right side. As well, patient can forget about any kind of scars. Scars cannot be seen maybe under the hairy part. Some patient is a very with big hairs here. So by your palpation you will find it as well. If in the observation you cannot find, by the palpation you will find some scars here, which will give you information about something. I had patients who had some surgery on the heart perfectly in the age of 1 year. Of course, he did not remember it. Yeah, sure. But, and of course, the scar is so thin that it cannot be seen under the normal here part of the thoracic part. So when I take my hand on under my fingers, I find that skin is not the same everywhere, and only after we recognize that some surgery on the heart had been done. Can you imagine? So it was. That's why I say that palpation is one of the important part. Now, after palpation, I only do excurse and I will switch on 2 videos for you, which is very perfect. I like them. First will be more anatomical and all the sounds will be given, which I am sure you never can recognize if you will not do practice for more than 1 or 2 years. So, after palpation, you will do auscultation. What is auscultation? Who remember?
It's listening to the heart rhythm.
Yes, sure. Let's see. So you will take the specific tool. Don't we see this kind of, my dear? Yeah. So with membrana, how do you think which part of this membrana will be used? If you know the stethoscope, sometimes it has 2 sides, one with big membrana, another more narrow part. Yeah. How do you think why we have it? From membrana part, my dear, this white part with membrana on it, sounds which we have inside increased to us to recognize it. So better to use membrana part when you auscultate lungs. But if you want to be sure, you have to turn it to another part which is more narrow. I will find. No. If I will find it somewhere, I will show you. Okay. Later, I will show. I do not want to stop my lecture right now. So, and turn it with narrow part which do not increase the sounds from the inside and give you the same sound that is inside. Yeah. So, and you differ them from the lungs problems. Then. That's how it works. But not always our new physicians use it. So I will show you then. So here is some points shown to you where we have to take our stethoscopes. See? How do you think what it is? This to the second intercostal. First rib, second, between the second rib and third rib, it's second intercostal part on the right and on the left, perfectly on the border of the sternum. What we have? How strange it will be, but on the right side you will listen left part of the heart. Why? Because heart is turned and the upper part here is the right side, so left is turned here and aorta is coming more from the right side. Aorta is from left ventricle. So here is side left ventricle. Aorta is going and turning here. See? And at the point where aorta going from the heart, it's on the right side, second intercostal. So on the right side, second intercostal, you will listen left part of the heart, aortal place. Named place, not aorta, because you listen not to the aorta, but sounds that are produced and going through the aorta to the most close part of the skin. On the left side, second intercostal, you will hear pulmonic area, pulmonic place area, which perfectly connect to the right side of the heart. Understand here? Is it given here? Yes. Aortic valve here, pulmonic here, tricuspidal valve. It's the, let's count which one is 1, 2, 3, 4. On the fifth rib ends close to the sternum, perfectly on the border. We have tricuspidal valve. Which valve is? From the right atrium going up here, and on the apex, from the apex, because why on the apex we can see mitral valve, which is the left ventricle, my dear, because you remember I show you anatomical part. Where is it? This one. See, apex, yeah, but you remember that muscles of the left ventricle is wider, so sound which you will hear here will be from the left ventricle, not from the right. Understand? That's why the left mitral valve will be more heard here. Now let's see which one is tricuspidal, which one is mitral. This is tricuspidal between the left one and atrium, and between the right, excuse me, from the right ventricle and atrium tricuspidal, and from the left one and left atrium it's mitral. Yeah. So do you remember names of these, tricuspidal and mitral? If not, doesn't matter. You have only to check if some problem exists. 3, it means it has 3 parts that close, and mitra is corona kind of. It does not have perfectly 2 parts. It's a lot of small parts looking like corona or crown. That's why it has this name, my dear. Excuse me, mitra. This one. Okay. So the points where you find, once again, take your sternum, find depression, calculate, so below the clavicle, perfectly the first rib. First rib between the first and second, second rib eminence between the second and third rib is the second intercostal. So second intercostal on the both position on the border, perfectly very close to the sternum names border. So we have to auscultate aortic valve on the right, so left side we listen on the right side, and pulmonic on the left side but produced by the right side of the heart. So go down, you will find tricuspidal valve, and on the apex of the heart you will find mitral. Tricuspidal connected to the right side because the more frontal side of the heart is right, but includes on the apex, the main mass of the muscles are from the left ventricle, so it will produce the sound from the left side, and it will be mitral sound. In cause all these places are so close to each other, my dear, that it's 2 or 3 centimeters between them. Of course, in the beginning you will do mistake. How to avoid mistake? Find some other places. So if it is aorta valve, it means that it's pressure that goes to the aorta. And we know that aorta make curvature here, and the first pressure will be somewhere here. Yeah, so heart beating here, contraction will do stress to the aorta. So if I hear some changing here, I will change position of the stethoscope slightly up to the neck on the left side. See here. If it will be produced or the same sound can be heard, I understand that I do not do mistake and it is aortical valve. If it is decreased here, so it means maybe it's more pulmonic and I do some mistake in my auscultation. Understand? If it increased or is the same, it means that this is the same area. If I hear something on the left border, second intercostal, I have to think, am I right or do mistake? What I will do? I will follow this intercostal to the side. Why? Because pulmonic, it means it goes to the lungs. Yes, so pressure here will go to the lungs. So I will take stethoscope apart. If sound do not decrease, does not decrease, excuse me, sound, so it means that it is valve and I am right. If decreased, it means that, oh my God, I heard it here, but for sure it comes from another part and it's my mistake. And I will find it and check by another examination. Maybe with ECG or ultrasound of the heart. Tricuspidal. Because tricuspidal is between the atrium and ventricle on the right side here, but it's seen on the left border, as you see, where it will be produced more to the right, and atrium is above, yeah, the ventricle. So if I will take stethoscope on the opposite side, on the right side, and the sound will be the same, it means that yes, I am right, it's tricuspidal. And now about the apex. Find some sounds on the apex, but as well it will be heard near to the border. So not always I can differ these sounds from each other. I will take my stethoscope to the side from the lateral side for armpit portion and listen from this part. See, producing of the sound in the soft tissue and hard tissue will be in the direction here. Here it will be covered with other sounds from the right side. So if I can hear the same sound from the lateral side, I will give information that this is perfectly mitral valve sound. Idea is clear? So sound, because it's sound and in the liquid, in soft tissue and hard tissue, it has some physical rules how they are going through. So only take information that by auscultation to avoid any mistake. Take your stethoscope off near to the neck on the right side. If sound is the same, it's aortical. Now, if sound change, so you do mistake and have to check other sounds. On the left side of the border, second intercostal, it's pulmonary. To avoid any mistake, you will follow this intercostal. If sound is the same by the physical rules, it will be pulmonical valve. If they changed or decreased perfectly, it means that maybe it's aortical and you do mistake. Tricuspidal must be rechecked on the right side. You will hear it if you cannot hear on the right side, so it means that it's done by mistake and must be maybe mitral kind of or some other sounds. I have no idea what it can be inside, but not heart as well. So about mitral, check it from lateral side. After auscultation, we do not need percussion of the heart. Do it give us any information? Yes, of course, some borders of the heart, but it's not so informative about the heart as in the abdomen will be. So we do not do percussion or hitting of the area of the heart. This is enough. Now let's see and give me explanation if you hear the sound of the video. I will try to do it higher.
.com or in the cardiology section of the Zero to Finals Medicine book. Let's jump straight in. First of all, we need to talk about the normal heart sounds, and we refer to these as S1 and S2.
So we will speak about the sounds, which I say it's very difficult to understand if you have no practice. Let's see.
The first heart sound, or S1, is caused by the closing of the atrioventricular valves. Now this is the tricuspid and the mitral valve. And this happens at the start of systolic contraction of the ventricles. So as the ventricles try to push blood out of the heart, the valves between the atria and the ventricles need to close to prevent blood from flowing back into the atria. The second heart sound, or S2, is caused by the closing of the semilunar valves, and this is the pulmonary and the aortic valves, once the systolic contraction is complete. And this is to prevent blood flowing back from the pulmonary arteries or the aorta into the ventricles. Now this S1 and S2 can be heard during auscultation of the heart sounds as a lub-dub sound. So let's have a listen to that now. Next, let's move on to a third heart sound, and we call this S3. And this is heard roughly 0.1 seconds after the second heart sound. It's quite subtle, so you can only just about hear an extra sound after the second heart sound. Let's listen to an example.
Guys, sometimes it's named gallop, as a horse is running. Tuck, 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 tuck.
Now what causes this sound is, I think of it as rapid ventricular filling, causing the chordae tendineae, or the tendons inside the heart, to pull to their full length and twang like a guitar string. This can be normal in young patients, 15 to 40 years old, because the heart functions so well that the ventricles easily and rapidly fill with blood. But in older patients, it can indicate heart failure, as the ventricles and the chordae are stiff and weak, so they reach their limit much quicker than normal. The way I picture this is, an older patient bending over and their tight hamstrings very quickly and sharply tightening as they reach the limit of their flexibility. This often sounds a bit like lub-de-dub, lub-de-dub. So let's have a listen again to what that sounds like and see whether you can distinguish a third heart sound after the second heart sound. Next, let's talk about the fourth heart sound, and we call this S4. And this is heard directly before S1. And S4 is always abnormal, and it's relatively rare to hear. What this indicates is a really stiff or hypertrophic ventricle, and the sound is caused by turbulent flow from an atria that's contracting.
Guys, good idea is that you need only to know it but not recognize. And if it will be written in your patient's history that he has S4 sound, you will understand that it's abnormality in the heart. It's what you have to know, but I will give you this part.
Against a ventricle that is non-compliant or doesn't want to fill with blood. So the ventricle is really stiff, the atria is trying to force blood in, and this is causing a turbulent flow. And what it sounds like is lub-dub. So let's have a listen and see if you can distinguish that fourth heart sound just before the first one. let's talk about heart murmurs. So when you're listening to murmurs while giving a deep bong, you want to listen.
That's what I speak about. Look, diaphragma and bell. I forget the name of this narrow part. It's bell. So diaphragma increase. Bell has the same sound that we have inside. Okay.
While giving a deep bong. You want to listen over the 4 different valve areas in turn for murmurs. So the pulmonary area is at the second intercostal space on the left sternal border. The aortic area is on the second intercostal space on the right sternal border. The tricuspid area is in the 5th intercostal space on the left sternal border. And the mitral area is on the 5th intercostal space in the mid-clavicular line, and this is the apex area. You can also listen at what's called Erb's point, and this is the 3rd intercostal space on the left sternal border, and this is the best place for listening to the heart sound, so S1, S2, S3, and S4. There's a couple of special maneuvers you can use to look extra clever in your OSCEs. This would be to put the patient on the left-hand side, or roll them over onto their left-hand side to listen to mitral stenosis. Or you can sit the patient up, lean them forward, and ask them to take a deep breath out and hold, and this helps you to hear aortic regurgitation. There's a few features of a murmur that you can assess, and we use a mnemonic called script. So S is for sight, meaning where is the murmur loudest. C is for character, so is it soft, blowing, crescendo, meaning getting louder, decrescendo, meaning getting quieter, or crescendo decrescendo, meaning getting louder and then quieter. R is for radiation, so can you hear this murmur going to the carotids, as you would in aortic stenosis, or going to the left axilla, as you would in mitral regurgitation? I is for intensity, so what grade is the murmur? P is for pitch. Is it high pitched or is it low and grumbling? And pitch basically indicates the velocity of the murmur. And then finally, T is for timing. So is it systolic or diastolic? So I'll go through that mnemonic again. Script, meaning sight, character, radiation, intensity, pitch, and timing. Let's talk about the grade of murmurs. So grading a murmur is quite subjective, but it can be helpful in assessing the severity of the defect, and it will also make you sound clever when you...
I will not ask you on exam all the description of murmurs, but is it subjective or not? The script will be given not right in this midterm, in the finalizing, or in the second. How it will be. Let's see, but more close to the last part. Okay.
Grade a murmur in your OSCEs. If in doubt, it's probably grade 2 or 3. So grade 1 is difficult to hear. Grade 2 is quiet. Grade 3 is easy to hear. Grade 4 is easy to hear and with a palpable thrill. So when you put your hand on the chest, you can feel the murmur. Grade 5 is when you can hear the murmur with your stethoscope barely touching their chest. And grade 6 is when you can hear the murmur with your stethoscope actually off the chest, just holding it nearby. Let's talk about hypertrophy and dilatation of the heart. Valvular.
You do not need it right now. Murmurs is enough to know about. And this part is, and then we follow the last one, how to do. The first what you have to do is wash your hands. You remember?
Hi there, my name's Andrew. I'm one of the final year medical students. Could I just check your name and date of birth, please?
Sure, it's James Alexander, 13th of December 1989.
Nice to meet you, James. Today I've been asked to examine your heart. This will involve looking from the end of the bed, feeling a pulse in your neck and your wrist, and also listening to the heart as well. Would that be okay?
That's fine.
Have you any pain anywhere before we begin?
No.
Have you any questions?
No.
Okay, James, we can start the exam now. And I'm just going to start by having a look from the end of the bed.
Cyanosis, pallor, edema,
James, I'd
we
like to start by
forget.
looking at your hands. If you could just bring them up in front of you, please.
What he is looking, what I say, nail changing sometimes give you information about the heart disease as well.
And if you could turn them over. Fantastic. And if you could bring two fingernails together like this for me.
And perfectly when we clubbing these fingers, if nail to nail is coming normally, it's good. If we have big places and our second, what is this, phalanges cannot connect to each other, it means that we have heart disease as well. Look.
And again, if you could just bring your arms out in front of you. I'm just going to assess the temperature of your arms.
Why he checked temperature? Because if the blood flow decreased, so part of our hands more close to the body will be warmer than distal part, and vice versa. Yeah, if it is a big stream, our fingers will be warmer than must be.
I'd now like to feel the pulse in your wrist.
About pulse, we will speak in the vascular part in another hour meeting, but for sure it must be checked, because about the pulse I have to speak more than half hour, so I will take it to another hour meeting.
And now I'm going to feel the pulse in the wrist at the same time. James, I'm now going to assess for something called a collapsing pulse. So in this, I'm just going to have my hand on your wrist and raise your right arm rather briskly. Do you have any pain in your right shoulder at all before I begin?
No.
Okay. That's fine, you can relax. I'm now going to feel a pulse at the front of the elbow. Okay, James, I'm now going to listen and then feel a pulse in the neck. When I'm listening, if you could hold your breath for me.
See which part of stethoscope is used. Not to increase the sound, it will be high sound and it will be mixed with breathing.
I'm now going to feel the pulse.
About pulse we will speak next hour meeting,
Could you
but
just turn
look
your head
it
to the
here.
left for me? James, do you have any pain in your tummy at all? I'm just going to press down on your tummy.
This is part of pulsation as well, so once again,
Bring your
next
head
hour
back.
meeting.
James, I'm now going to have a look at your face and eyes. Okay. You could just look straight ahead for me. And I'm now going to pull down on your lower eyelid.
Why we need to find out pale.
If you could just open your mouth for me. Lift your tongue to the roof of the mouth.
Cyanosis,
That's great.
central and peripheral.
I'd now like to more closely inspect the chest. You could just lift your right arm up for me. And your left arm.
So lymph nodes mainly are in the armpit, so they give information about the infection in the thoracic part. Calculate the intercostal C. Palpation Under the finger, you can feel or murmurs, or thrills,
James, I'm
or
now gonna listen to
palpation,
your chest,
or
and I'll be feeling the pulse in your
palpitation.
neck at the same time.
Now auscultēt the heart valve. Compared here, because by the bell, it's not increased. Oh. ADM. I do something wrong. Okay, my dear. So let's go once again through the portion. What about the pulse? Pulse is answer on the heart beating. Today I will give you small information, and then we will do it more deeply next our meeting. So when heart is pumping, working, it press the blood to the vessels. So vessels borders are shaking, and this shaking is named pulse. What is interesting to us that in the previous centuries, when they have no tools and electronic ECG and ultrasound, this has a kind of examination, they can recognize more than 60 diseases only by pulse. Imagine how important is pulse. So, where can we find pulse? Every kind of vessels. We will check on the big ones. Mainly the closest to the heart are our hands. Yeah, sure. And more free zone. It's difficult and not comfortable to patient to take the neck area to check the pulse, yeah? But more comfortable if you check it on the inner side of the hand, or more close to the thumb, where the radial artery comes. So we check on the radial artery, which perfectly is here. You can see it done by red color. With 2 fingers is shown here, but in the beginning I ask you to use 4 of your fingers.
Does it matter right or left hand?
I will give you explanation. Take 4 of your finger to check. Why? Because in the beginning it's difficult to find and did not irritate the patient. Took all your 4 finger on this line, and under one of the finger you will find this pulsation. It's life hack from me, because when you begin to change the position, your patient will understand that you are not deep in the knowledge of the pulsation. Do not irritate. Take 4 fingers in the beginning. Then with the practice, you will do it with 1 finger as well if you want. What about the hands, left or right? Of course, we have to do it on the both hands simultaneously. It's best way. Why? Because we compare pulsation in the both part. It will give us information, is it distributed the blood by the vessels to the both hand simultaneously and with the same strength. Is here coarctation? Is here dilatation? Is here some strength of the vessels or not. That's why on the both together. But where is more comfortable? Everyone answered on the left. No. The first beating by anatomical position of the heart will go to the aorta, and the first branch of aorta, where is? On the right side, and it branched to the right hand. So pulsation on the right hand is more comfortable, and first beating sounds on the right hand, not on the left. Okay, it's a very interesting point, but no one from my student answered me right before the lecture. So right hand is first beating taking, but but it's so small difference that not everyone can compare them. That's why we check simultaneously on the both hands. Then, my dear, not only hands. Where it is on bigger vessels. Okay. No. Okay. Hands on legs. Okay, take legs. So, pulse can be taken not only hands, but on the legs as well. On the hands, we do it on the radial, then on the what I'm writing, who knows, where is it? On the, oh my god, one picture. This is okay. So as I say, on the radial, then you take this joint from the inner side where arteries are close to the skin. Who remember? On anterior side, yeah. On posterior,
Say it
there's
again.
more muscles, so it will be bigger. So you can check it. So where the flexure exists, the flexible point you can find. So you will take your finger here as well to find these both branches of brachial arteries and check it. So first radial, then on the joint brachial. In the armpit as well, you will check this part of the subclavian going to the femur part, to the femur part, excuse me. Then above the clavicle, near to the sternum, you will check subclavian artery, and going up to the head. See this one, my dear, must be checked as well, like common carotid artery. If all these parts we do simultaneously, the only carotid arteries that cannot be checked together. Why? Because if you press them, it will be lack of oxygen to the head and perfectly to the structure which you have inside, and dizziness and unconscious will exist. And if you press more than 2 minutes, you can kill your patient. Yeah, sure. That's why we do not do it on the both carotid arteries together. So once again, we have to check almost all joint. Compare the two parts, and remember, in cause of position of the heart, aorta curvature, and first branch is on the right. So pressure of the heart and bloodstream perfectly goes at first on the right and only after to the left side. Yes, it's not big difference in normal patient, but if mainly sometimes in between these two one we have stress or narrowing of the aorta, and that's why on the left side is lighter and more soft and low pulse sometimes than on the right, and you can compare. Okay, in the abdominal part is very deep, but I will show you how to check it. As I said, next our meeting, because abdominal examination, we will begin with the pulsation as well and the observation. Then we will go to this point where the flexure of the leg exists. So see, when you flex it, take this point. Why? Because then it begins dividing of these arteries, common arteries on the two parts. So pressure will be checked very easily. Compare these two parts to each other to understand abdominal part, because all kind of cancer, infection, and so on change the pulsation and change the arteries and press the arteries and change the blood stream to one side or another. Then we will go on the knee position, and what I say, where the flexor exists, flexion. So behind the knee, you will press and find popliteal arteries from the backside. It's very difficult. I will show you on the videos next our meeting how to check it. Compare these two parts to each other as well, because here is big amount of divisions of the artery, which must be thrombosis as well, thrombosed, and decrease the pressure to one or another leg. Then you go down and find on the flexion position, it means that on the side where the flexion exists, you will find dorsal artery and check it. But as well, I will show you one point as well. So here, my dear, see, behind this emanation, near the Achilles tendon, you have to check arteries. See this part? So it goes on the anterior side, the flexor exists, but we have some branches which must be checked from the back side. This is what I say, popliteal artery in the knee from the back side as well, where the flexor exists. Here is tibialis, my dear. Here is dorsalis on the flexor side, popliteal and femoral on the leg. More close to this arteries view and examination we will do next our meeting. So can you imagine with a previous picture? This one, okay. In many countries, once again, I explain it. In many countries, doctor cannot see all the patient and check all the patient, can use only the hand of the patient, and perfectly women cannot be the patient of the doctor, yeah, in many countries. So permission can be given only for the area of the hand to be checked. So by the nail, by the cyanosis peripheral, by the erythemas, redness on the inner side, and by the pulse, previous centuries, doctors did right examination and the right diagnosis to the patient. Can you imagine? So be careful in your examination and in your notes, and you will do it right. So what else? I have nothing to explain right now. I think it's big amount of knowledge which nowadays it's mess in your head. But once again, let's take point by point. Your patient came in. First look is skin and all abnormalities. Swelling underneath the eyes, maybe kidney, maybe heart. Changing is the color, yellow, red, blue, white. Changing in the color in the head area or in the legs and hands as well, so cyanosis. Is here changing in the skin like papula or other how it is spots? Then you go through the nails and check if it is nail normal or abnormal. Changing in the nail gave you as well information. Is it heart disease or is it infection or inner organ disease like HEPA or spleen or intestine and so on. So then observe the patient. Skin is observed. Next, you will ask your patient to take off his t-shirt and to look the thoracic part. As well, all the scars, all the point, all the spots on the skin must be described. Then as well emanation and palpitation, pulsation of the area must be described. So with your eyes you finished. Now begin your hands work. Next time we will go through the pulse, but as well pulse checked because it's function of the heart pumping the blood, and you check pulse like answering of the vessels on this pumping. Compare the parts of the body because we have cardiovascular, yes, destruction. So then take your hand and palpate area of thoracic. If you feel some thrills, pulsation, or other kind of changing underneath the skin in the area where heart is and the big vessel exists. Where bigger vessels are? About the clavicle near the neck area. So it must be checked as well. Position of the heart. So, and the main points behind the sternum and going to the left side from the fifth intercostal on the 6th centimeter where we have the maximum impulse point or apex of our heart. So take finger here to find out pulsation here. So it's the most close part to the skin. By your hand you can do nothing. Now you will take a stethoscope and find out what's happened inside the thorax or sounds that's produced by the heart. What is normal? Normal we have S1, S2 lub-dub sound, closing and opening of the valves. Every additional sound must be described. So lub-dub-dub or la-lub-dub. It's S3 and S4 additional sounds. It's difficult to understand, but if it is something not normal for you, you will only describe, nothing more. So then it will be murmurs. Murmurs in the heart, it means that like by your throat you do some bulbs in the juice, in the glass with juice or water when you are breathing air inside the liquid, yeah? Bull, 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 something like this. The same happens in our heart when the valves cannot close perfectly and some blood is going bad. So this changing this crossing this bloodstream and bulbing inside gave you murmur. So murmur always, not always, are abnormal. In the young age, when your baby is growing very fast, not always valves follow the heart size. Heart became big, valves need time, and in this period, regurgitation is physiological. You are waiting 6 months, recheck it. If it changes, it's okay. If not, you will go to the specialist to check what's happened, why valve is doing this murmur sound. So, and as well, it will be in the sportsman. So, sportsman heart as all the muscle of the heart will be trained. Yeah, so it became bigger. So valve is the same, but heart muscle is so strong that or it closed very perfectly, or it stretched perfectly, and some regurgitation exists. Okay, so next you will find a specific points, second intercostal on the both border of the sternum, right and left. Do not forget, on the right side you auscultate left part of the heart, on the left side in the second intercostal you auscultate right side of the heart. Then you go down to the fourth intercostal perfectly, or fourth intercostal on the or ending on the fifth rib, perfectly close to the sternum. Here will be tricuspidal. It's between the right atrium and ventricle. Then go 6 centimeter side from the sternum and fifth intercostal position. On the apex consists of the big amount of the muscle, and a bigger muscle we have on the left side. You will find the left atrium sound here. It will be mitral valve sound. Okay, so by auscultation you will finish. If you think that some abnormality exists, you prescribe your patient to do ECG or ultrasound examination, which you prefer in that or this situation. That's what I want to say to you today. I think it's a big amount of knowledge, but you can take it. Okay, my dear. We cannot hear it. Okay, my dear, do you have any question?
No, it was good.
Okay, thank you. I will repeat part of this lecture as I always do, like about the skin. We take some points right now, and we will speak about the skin in abdominal examination, because some spots, some points on our abdominal side is connected to the skin examination as well, and give you information about the inner diseases. And as well, we will speak about the pulsation once again, and about some differentiation between the pulsation in the area of abdomen, which comes from the heart disease or from other diseases. So every my lecture with some point will be continuous of the previous and repeating of the previous lecture. If
Thank
you
you.
will
Just
have any
yeah, one
question,
last thing. Yeah.
yeah.
90% of the lecture, your voice was so I don't know, so many likes from the internet. So that was like 90%. When we told you, it fixed like 10 seconds, but it came back. Heart
I
was
have to
still.
change, I think I have to change this notebook. It's given to me from our IT department, and it's technical problem. I asked them to fix. They did something, but as you see, it's not enough. So it's good that you no one from other groups give me this how it is note, but it's good that you say it. I
Thank you.
will fix it. I will ask for no new notebook for our lectures.
Thank
Thank
you so
you.
much. You're welcome.
Okay, thank you. Okay. Okay, dear, that's all for today. If you will have any question, we can discuss next our meeting.
Thank you. Bye bye.
Bye.
Bashir, we're gonna stay to discuss some things, alright?
فاضي سامع
Okay.
بس ضايل شو اسمه
It's okay. It's okay. عادي خليها تسمع. So I didn't understand about the midterm, the first midterm. The first midterm has been held, or the exam still we didn't do it? Because Shahid Abed saying that Monday we have an exam, but I don't know. Is it the first midterm or the second midterm? Lizzie, you know anything about this? Ah, the recording is still on. Wait, stop recording. The recorder will be saved in any. Okay, yalla, stop.